Hi, my name's Jake. This is the week 3 skills module. This is the dressing change / wound care. And that's my badge. And with that being said, we'll start. So, hi, my name's Jake. I'm going to be your nurse here at Chamberlain Hospital. Can you state your name and date of birth for me?
Billy D. Sponge, 2 February 88.
And I'm checking name down as well, and everything checks out. So the reason why I'm in here, Billy, is the doctor ordered a dressing change for your wound. Do you have any questions about that?
No questions.
All right, it should only take 10 to 15 minutes. Do you have any allergies I should be aware of?
No allergies.
All right, do you have any pain right now?
No pain.
All right. With that being said, we'll start. Do you consent to this procedure?
I do consent.
Thank you, Billy. So we're gonna hand sanitize. So hand hygiene. We're gonna put on our clean pair of gloves. All right, so we're going to remove the old dressing. So take off the tape, the abdomen pad, and we're going to pull out the old gauze. And when we pull out the old gauze, we have to remember the COCA acronym. So we're looking for any color, odor, consistency, or amount. Obviously, in this situation, we don't have any. Next, we're going to move on to actually assessing and inspection of the wound itself. So from a visual standpoint, there's no eschar. We're going to pull out one of our Q-tips. And we're going to be looking around for any tunneling or undermining in the wound. And given this wound, there's no real undermining nor tunneling, which is good. So put that into our trash receptacle. We're going to go on to measuring the wound itself with our target. And obviously we've already done this a couple times. So from a proximal distal, lengthwise, it's around 10 centimeters, and from a width, from the largest gap, it's 2 centimeters. We'll put that into the trash receptacle. Now we're done with these pair of clean gloves. So we'll put that in our trash receptacle. We're gonna reapply hand hygiene and put on a new pair of gloves. Now we're going to go on to irrigating the wound itself. So we have our sterile saline as well as our sterile syringe. Without touching the middle part, the actual plunger. This is our 30 to 60 milliliters, in reality it's 3, of saline. So we're going to irrigate the wound from a top to bottom motion as well as left to right without touching the tip to the actual wound itself. So let's see how well it does. So we're gonna keep doing that until put that there. The saline is clear or just a light pink. With that being done, we're gonna take our clean gauze, dry gauze, and we're going to lightly pat the wound. And since it's a sponge, it doesn't really work, but that's okay. We're going to take off these pair of gloves now and our clean part. We'll do hand hygiene again and move on to the sterile part. So very carefully, we're going to open it up, and we have our sterile gloves, which we will put on right now. We're going to pull from the inch and a half corner. And we're going to put on our first glove. And go underneath. There we go. Now we have our sterile gloves on, so we can push that over there. We have a couple different things. We have our sterile saline, which we're going to make a little reservoir right over here for. So pouring it off without spilling nor splashing it. That'll be good. Put that to there. Next we have, don't really need a whole lot right now from that. So we're going to wet a clean piece of gauze. Going to dry, well, need a little bit as well as kind of a little cheerleader. All right. And we're going to open up our sterile Q-tip, and we're going to lightly push it into the wound. It's okay. And the wound's a little small, as you can somewhat tell. And with that, we kind of get everything, kind of saturate the wound itself. We're going to put that into our trash receptacle. And next we're going to move on to actually taping the wound. So we have our little abdomen pad right here. We're going to put that right there. And we're going to tape it. Obviously, it's not going to be the best since it's a little small. That's all right. So we're going to make a little window pane fashion tape. And it's not really taping because it's a sponge, but that's okay. The idea's there. That being said, we're then going to put on our little sticker, not onto the patient. However, we'll put that onto the tape. Tend to. With that being said, we'll now take off our sterile gloves if we don't need them anymore. We're then doing hand hygiene. Billy, is there anything else I can do for you?
No, feel great. Thank you.
All right. We're going to dispose of everything in the proper protocols and all that sort of fun stuff like that. But I think that'll end it. So thank you very much.